Hi, I am Princess May A. Lagamon, a member of Group 2, and we are going to discuss about caring for a pediatric patient. Caring for a pediatric patient is an essential part as a phlebotomist. This requires a huge amount of patience and special considerations must always be taken into account. In performing pediatric phlebotomy, this is not only an important duty for a phlebotomist, but this is also a detailed procedure that must be followed correctly in order to make the patient and the parent comfortable. The phlebotomist is working to accommodate multiple individuals when a parent and a child are involved. The patient's comfort should always come first before any procedure is started. The decision must be made whether to perform heel stick, venipuncture, or finger stick, depending on the age of the patient and the types of sample needed, and lastly, the ability of the child to hold still while the collection is obtained. We must take note that these are unfamiliar experiences for them. We must provide the patient with a calm yet confident approach, because confidence with a pleasant demeanor will help both the child and the parent to relax. Now let's move on to keys to caring for pediatric patients. First is to be calm and confident. Second is to get down on the child's level. Third is to explain every step of the procedure or explain the whole process to the child slowly. And third is role play with the child by showing a stuffed animal or a doll. These keys are important because a child will feel less scared if your eyes are in the same level as them. Avoid approaching the child with needles or sharps or any other devices that are unfamiliar to them. Carefully bring the needle out at the last moment to avoid prematurely alarming the child, and do not act as if you are hiding something, because this will alarm the patient or the patient will feel more and more anxious. In this case, the patient is not your only concern. You must also assure the parent. You must slowly explain the whole process to both the patient and the parent. Reassure them that you are confident and you know what you are doing.
Hi, I'm Prexel Red Cabanyog, and today we will be talking about a child's understanding of illness. Caring for pediatric patients is a challenge for health professionals, especially in the part where they have to explain and make the patient understand what disease they got and why they have it. As the child ages, so does their capacity to understand why they are sick. In this topic, we will be talking about the breakdown of a child's understanding of illness by age. The first 2 years, they have limited understanding of illness beyond being sick. They still don't understand why they feel bad or ill, and all they can do is to complain about it. All they know is they feel something bad is going on with their body. They experience stress due to separation from familiar caregivers and changes in home routine. Ages 2 to 6 years. They have magical thinking that creates misconceptions and fantasies. This is because at this age of a child, they are more into fantasy because of what they see in cartoon movies and etc. Medical care may be viewed as punishment for bad behavior. Because children at this age are naughty, they think that it is the result of their bad deeds. Internal organs or parts are difficult to understand, and medical play is optimal for illness education and medical procedures. This is essential in making them understand and tame them to perform procedures successfully without making them feel scared. 6 to 9 years. At this age, they understand some mechanics of health like digestion and respiratory, and they have basic understanding of how their body works. They also have prevalent death concerns and understand how procedures and medications help the body fight disease and cure. Medical play and body drawings are useful tools for education and coping, and at this age they still have some misconceptions and fantasies. Ages 10 and older, they have fairly clear understanding of what is illness and can explain why they feel ill. By this age, they now have a broader understanding of illnesses and why they have it.
Managing pain. One of the most direct methods to manage pain before a venipuncture is to use a topical anesthetic to numb the site of the venipuncture. Lidocaine and prilocaine cream or Elamax can be applied to the skin in the location of the site to be punctured. Once the cream is applied, it takes about 30 minutes to fully numb the area. Other topical anesthetics available are Amitop or Smith and Nephew Healthcare, and 4% lidocaine or Ferndale Labs. These all require a prescription, therefore cannot be bought over the counter. The disadvantage is that if you treat the left arm and cannot get the blood, you must switch to the right arm. The cream must be applied to the right arm and the patient will have another wait for the anesthetic to numb the new area, and this adds an hour to the time an already anxious patient must wait. Sweet is for younger children that require a heel stick that used to pacify them during the procedure. It is a sugar-coated pacifier that children can suck on for comfort, but always check with the parent or nurse before giving this to the child. There may be other testing that requires the child to remain fasting.
Distraction been found to be more successful in calming a child during collection of a blood sample than the reassurance of the parent. When the parents say, "Don't worry" or "It's okay," this will often communicate to the child that he or she has something to worry about, that no one else is telling the truth. Children tend to show more fear with parental reassurance than with distraction. One of the best things that you can do if you're going to have a blood extraction to a child is unfocus the patient or the child in fun instead of the procedure. Children are most focusing on fun is less the pain that they can receive. It is important to plan to select that they can distract, for example, role-playing, bubbles, or even a flashlight, and lastly, the storybooks. As you can see in a short video, there are many distractions to a child, just to have a perfect blood extraction that you know. Some kids are always watching videos. Also, the best technique is reading a book. Your job is to pay the attention the child, stay focused, and engaging the child in the distraction. You always need to be patient to a child, since some children are not easy to deal or to distract, so that's the time you are going to have a role playing. This one is the best one to have a calm patient or child, also to have a successful of a blood extraction to a children.
Good day everyone, my name is April Enriquez and I will be discussing the sample collection from an infant or a pediatric patient. So we have four methods of collecting blood from infants or pediatric patients. We have finger stick, heel stick, venipuncture, and dorsal hand vein. Finger sticks and heel sticks are usually performed on infants or small children when there are only minimal testing requirements. So here are the following common tests that are usually performed by these methods. We have neonatal screening and bilirubin for newborns, and complete blood cell count, hemoglobin, and hematocrit. Next is venipuncture. This method is performed on older children or children for whom several laboratory tests have been ordered. So here are the following tests that must be performed by venipuncture. We have routine coagulation studies, specifically prothrombin time and activated partial thromboplastin time, blood cultures, lead level testing, and tests that require a significant amount of blood, such as allergy testing. So we perform venipuncture on infants or children the same way as we perform it on an adult. However, their veins are much smaller, so they are harder to locate and they have a tendency to collapse. So we use a smaller 2 to 3 ml evacuated tubes or a small syringe attached to a 23 gauge butterfly, so that we can avert a collapsing vein. So next is the dorsal hand vein. The dorsal hand vein of a newborn less than 2 years old is often preferred as an alternative to a heel stick or finger stick. The blood volume obtained is nearly the same as the heel stick or finger stick, but there is little trauma to the cells, resulting in less tissue fluid and hemolysis, which is why it is more preferred. When performing the dorsal hand vein procedure, the child must be held securely by the parent or restrained by a blanket to prevent the child from moving. We use a clear hub 23 or 25 gauge syringe needle to access the dorsal hand vein. The blood is allowed to drip out of the hub instead of being collected with a syringe. As the blood drips out of the hub or hub of the needle, it is collected into a microcollection device. Now let us talk about the procedure. First and foremost, of course, we perform hand hygiene and apply gloves before any patient contact. Next, we identify the patient. If it is an inpatient, we check with the nurse to identify the patient and verify the identification bracelet name with the requisition information. If it is an outpatient, we ask the person bringing the infant in for testing to identify the patient. Next, we verify the collection orders. 4. We choose the hand with the most visible dorsal vein. 5. We select the appropriate microcollection containers and needles. 6. We immobilize the child. We do this by having someone hold the child or wrap them in a blanket to restrain them. 7. 7. Wrap your hand around the wrist with your thumb, holding the fingers of the patient in the fist and your index finger on top of the wrist, as you can see here in the picture above. Next, we apply enough pressure to enlarge the vein. We apply pressure with our hand. We do not need a tourniquet for this. 9. We clean the site with alcohol and let it dry. And then we select the appropriately sized needle for the vein to be used. Again, we use a 23 or 25 gauge syringe needle. 11. Wrap your hand around the child's wrist as was done in step 7. 12. Line up the needle with the selected vein and insert the needle at a 15-degree angle until the blood fills the clear hub of the needle. 13. Fill the microcollection tubes from the blood dripping from the needle hub. 14. Relax pressure on the child's wrist to allow additional blood flow. 15. After all microcollection containers have been collected, remove the needle and apply pressure to the site with a gauze, square, or cotton ball. 16. Dispose of the needle in a sharps container. 17. Seal the sample containers. 18. Anticoagulant samples should be mixed 5 to 8 times. 19. Label the collection containers. And lastly, 20. Perform hand hygiene after completion of the procedure.
I'm Carmen Sembrano and I'm going to discuss the topic proper restraint techniques and patients who are resistant and difficult. First is the proper restraint techniques. First is the restraint of a child in a parent's arm. The parent may hold the child on his or her lap while holding the child's arm in a very straight position and restraining the rest of the child's body. This is a very effective method of restraint and is preferable over other restraints. This method is effective only if the parent or guardian feels that he or she can comfortably secure the child. Wide body chairs are used for this, and it is large enough for the parent and the child. Second is the supine position restraint. Children who have a high tendency to move with the parent holding them need to be placed in the supine position. This allows several people to approach the child from different sides. The parent or another phlebotomist can lean over the opposite side of the bed and hold the arm while also restraining his legs or her legs. Papa's board is used for mainly infants and toddlers. It is used to place the child's entire body and secure it with Velcro bands. The papoose technique is extremely traumatic to the child and is usually used as a last resort. Lastly is the blanket restraint of a child. A blanket wrapped around the child is an excellent substitute for the papa's board. Wrapping in a bedsheet or blanket is less threatening to a young child than a standard Velcro restraint system. The entire procedure proceeds more smoothly than with commercially available restraints. Second is the patients who are resistant and difficult. Another crisis that may occur in pediatric phlebotomy is resistance. Older children who are aware of what is about to happen can be difficult to deal with. They will fight not only the phlebotomist but also their parents, and getting them to cooperate takes patience and compassion. However, getting the child to cooperate is not solely the phlebotomist's responsibility. The parents or guardians need to help to restrain an out-of-control child. The phlebotomist, as a caregiver, can do only so much to get the patient to cooperate. The phlebotomist cannot force the child to have the procedure done unless he or she has the parent's help. The phlebotomist may not always be successful in getting the child's full cooperation, but he or she still needs to remember that patience and understanding are the best tools for safe and successful venipuncture.